Now, yesterday, the CBO came out with its numbers on Trumpcare, and holy crap, is it bad. The analysis predicts that 24 million people will lose their insurance coverage, which, of course, will double the share of Americans who are uninsured from 10% to nearly 20% within the first 10 years. Now, the office projects that the number of uninsured people after the first year would jump to 14 million. So 14 million, the first year that Trumpcare is implemented, gone. 14 million people immediately without insurance, gone. You're not going to have insurance anymore. Sad day for you under Trumpcare. And then, of course, 10 million over the next 10 years. Now, what happened with the promise of covering everybody? Now, I thought everybody was going to have great health insurance, and it was going to be cheaper. Everybody was going to be covered. It was going to be fantastic. If you listen to Donald Trump at any point during this campaign when he talked about health care, he said, oh, well, Obamacare is a disaster, rising premiums, not enough people are covered. I'm going to cover everybody, and it's going to be cheaper. It's going to be better. It's going to be fantastic, tremendous, believe me. Well, this is not that. This is less people, higher premiums. And look, I haven't even gotten to how much it's going to cost. But first, one of the primary drivers is, of course, people are going to lose their Medicaid. Now, they're saying, okay, since they're going to restructure Medicaid, they're going to essentially turn it to a block grant and give it to the states. Well, the states, what they're going to do when they get this block grant is it's only going to be a fixed amount of money. You're never going to get a different or more amount of money as prices rise. And as prices rise, and they will rise, you're going to have less money to be able to change, to be able to cover everyone, which means you're going to end up dropping people from Medicaid. And again, these are the poorest, most vulnerable people that have to go on Medicaid. But no, we're going to have less money. We're going to cut that. And that's actually going to cut the deficit by $337 billion. Well, good job. Good job. You only lowered the deficit by half of what you plan to spend on the Pentagon in 1 year. And all you had to do was just kick lots and lots of people, millions of people off Medicaid. Congratulations. Real smooth there. Again, these were people that were so poor that they can't afford private insurance. But that's okay. Let's kick them out anyway. They're moochers. They're leeches on the system. Of course, that's what they'll obviously say. And that's what they say before, and that's what they've always said. Oh, these people, they don't deserve health care. They're poor. You know, health care in America, that is a luxury that only certain people should be able to have. A luxury. Well, that's fantastic. God, man. So, look, and you know, this is kind of ironic, too. Because along with some of the promises that Trump made, I'm going to save Medicare. I'm going to save Social Security. I'm not going to cut it a dime. I'm also going to protect Medicaid. Oh, oops. Another failed campaign promise. Of course. So let's get to the other promises that he's broken. Premiums. Let's talk about premiums. And the CBO also predicted that premiums would be 15 to 20% higher in the first year compared with those under the Affordable Care Act or Obamacare. So everybody who was sitting there saying, oh my God, my premiums under Obamacare exploded. Well, if 15 to 20% isn't an explosion, I don't know what the fuck is. And now, while it's true, premiums increased under the ACA. They also increased every year before the ACA, but at a faster rate. So what happened is that when you passed Obamacare, yes, premiums still go up, and that was a huge problem, a huge flaw in this piece of legislation, of course. But what it did is that it slowed down the rate of premium increases, as it had increased much faster before the ACA. Well, now we're getting rid of all those protections, and here you have premiums increasing, going back to increasing just as fast, if not faster, than before the ACA. I mean, look, Trumpcare, again, is going to send it up 15 to 20%. Holy hell. That's a huge increase, and people are going to notice that. People are going to feel that. And look, there is a winner, of course, in this. Now, the report states that by 2026, it is estimated that premiums will be 10% lower on average. On average. So let's look why that would be. Well, of course, older, sicker people would likely no longer be covered or be able to afford insurance because they're older and sicker. Now, that's going to leave a pool of younger, healthier people that have insurance. Well, that's great for them, right? They end up getting cheaper premiums because there's less old, sick people to take care of. And the older people, unfortunately, if you're old, sick, and poor, you are not going to be able to afford this insurance. You're essentially going to die because you have a lack of care. You are going to die, D-I-E, die, because you can't get covered. Those tax credits that they're giving out as part of this plan, they're based on age. And yes, you get a bigger tax credit when you're older, but it's actually less generous than what you get under the ACA. So, disaster. Look, this is essentially social Darwinism at work, okay? And it's exactly the opposite of what insurance is supposed to do. What you need to make any insurance work is you need a large pool of healthy people, hence the individual mandate, which is the thing that I know that everybody fucking hates. And I get it. I understand. They all hate this. But it's actually vital to making something like this actually work, because you get a large pool of healthier people that will end up subsidizing people who are poorer and sicker and older. That's how it works, man. That's insurance. And there are a lot of Republicans out there that don't understand how insurance actually works. They think that getting rid of the sick people will actually be a better option. Well, I mean, I guess if you only have healthier people in the pool, they're not paying out as much. So, of course, the premiums might be a little bit cheaper, about 10% cheaper. But what they're doing is that, essentially, they're shifting the cost to the older people who can't afford to go, who actually need that health insurance, so they're going to die. Well, those people are going to they're going to be borne a lot more of the cost. And, yes, it is fair to make older, sicker people pay a little bit more, but this is a lot more. And how it's going to shift some of that cost, as well as having the tax credit that is much less generous, you also have the ability for insurers to charge older and sicker people up to 5 times more than a healthy person. The ACA limited that to about 3 times. And then, of course, you get the CBO's result that older Americans would end up paying substantially more and younger people less. So all those people who are 40, 50 years old, who are like, my premiums are too high, I'm going to vote for Trump. Well, guess what? You just voted to increase your own premiums. Because that's exactly what would happen under this plan. Sad. Now, look, I said the CBO says substantial, right? Well, let's do a comparison, right? If the GOP plan is enacted, a 21-year-old making $68,200 would pay an average of $1,450 for a year's worth of insurance premiums after the new tax credits. Now, that's compared with about $5,100 under the new law, or under the current law. So, obviously, if you're 21 years old, you're young, you're healthy, and you're making $68,000 a year, which is pretty damn good for somebody who's 21. I mean, I can't think of any 21-year-old off the top of my head that was making $68,000. Whoa! That's a lot of money for somebody who's younger. Obviously. Now, they would pay more. They pay more under Obamacare right now. If Trumpcare is enacted, they save. They save quite a bit of money, actually. So if you're 21 years old and you're making a lot of money, you are doing pretty goddamn good under this law. You're one of the winners. Now, let's contrast that with the 64-year-old. The 64-year-old person making, for example, $26,000 a year. Now, the cost would rise from $1,700 to $14,600 a year. Holy shit, man. $14,000 a year. That is more than half your income. That is somebody who's likely still in poverty making $26,000 a year. Damn. That doesn't even count deductibles, copays, or anything else. That is your premium. That's your premium. Look, older people, especially if you're poor, you are completely and utterly fucked under this law. This just says basically, hey, old people, you cost too much. Die already. We don't want you to have health insurance. Go in the street and keel over already so we don't have to pay for your ass. You cost us too much. I'm worried about my bottom line. I don't care about you. Because it's not the insurance company's job to care about you. All they are is a middleman. They don't actually provide health care to you. They are a middleman that is skimming profit off the top. That's all they're there for. And that's all they do. Now look, that same 64-year-old who's making $68,000 a year, well, they'd actually do better. Now, he would still pay about $14,600 a year. And because he gets a tax credit, he will pay actually a little bit less than he does on Obamacare, but just barely. So basically what this is that's a giveaway to people who make more and more money. If you have more money, you actually do better under this plan, and it hurts the most poorest and the most vulnerable. And that's what this plan is all about. And so the biggest benefits go to people who have more money. And for example, people making over $200,000 and $250,000 a year, they will receive in total of about $157 billion in tax cuts. Tax cuts. The richest 400 families in America will get an average tax cut of about $7 million. So who's the real winner here? People who are wealthy. That's it. Look, if you're 21 years old and you happen to be a rich asshole, I'm not saying they all are. I'm just saying, you might be celebrating. But if you were poor and you're 21-year-old and you're poor, you still also might be hit hard. Not as hard as that 64-year-old, but you're also going to be hit. So, and that's because, again, they don't give a shit about you. They don't care about you. They don't care about health, right? You don't, if you're poor, you don't help bring in money to the donors, those health insurance companies. They don't care about you. And it's all about following the money. And we say it all the time. Follow the money, follow the money. This is all about profit over people. These insurance companies, by the way, also get a huge tax cut under this proposal, under Trumpcare. They will end up making bank. Look, if you criticized Obamacare for being a giveaway to insurance companies, which I have, you have to realize that this is an even bigger gift to the rich and to the insurance companies. That's the problem here. Now look, this is so bad that I actually sort of have a little bit of hope. Let me explain. This could actually convince people to move towards something better, towards a single payer Medicare for all system. Hear me out. I know a lot of people might be like, come on, Jeffs, that's crazy. That's crazy. That's super left-wing plan. We could never do that. I don't know, man. Last night, you did have Bernie Sanders holding another town hall in the middle of Trump country, West Virginia. And during that town hall, he did get to that. He got them to admit, yes, a single-payer plan, a Medicare for all, that sounds like a great plan. That would actually help out. Then we wouldn't lose our insurance, wouldn't have to deal with insurance. It's not like there are Trump supporters out there that aren't open to this, that don't look at our problems with the ACA and go, we can do something better and actually cover everyone. Now, of course, there are some Trump supporters also that are like, no health care for anyone, unless you're rich. But there are a lot of Trump supporters out there who were left behind by the Democratic Party, who listened to Trump and listened to him saying, don't worry, we're going to cover you. I'm going to take care of you. I'm not going to let people die in the street, because those are things that he said. And this is the thing about Republicans, too, is that they tend to run on, no, we want everyone to be covered. Now the lie is we want everyone to have access to health care. Well, access doesn't necessarily mean you're covered. But they got to say these things because they know that when you say a significant portion of Americans are going to be cut off from insurance, we don't give a shit. Well, obviously, that's going to make a lot of people very, very angry because people like their insurance. People like having this insurance and having the option of getting this insurance. So this is saying is that single payer is a possibility. If you have people out there that start talking about it, having serious discussions about this and pushing this as a policy, and saying, no, we actually know how we can cover people. We can cover people, we can cover everyone, and we can do it cheaper than the insurance companies can. This is how. You sell that message to people, and even Trump supporters, they'll respond. There is hope, okay? As long as we keep fighting for it, as long as we start messaging on it, then we will win. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.